Very good evening. Today we have Dr. Culver with us all the way from Cleveland, Ohio. A very good evening and welcome to India. So can you describe a little bit about your role in Cleveland Clinic?
Sure, I'm a lung doctor. I've been with the clinic since the beginning of my training. So I'm now the chief of pulmonary at Cleveland Clinic.
Oh, great.
I started off with many interests. Now I've narrowed my clinic down. And my main job is just to help develop the team.
Oh, great. So Dr. Culver, after COVID, we keep hearing a lot of stories around long COVID. And I think patients are very curious to understand how they can protect their lungs. And do you have any general messages for our patients and the community listening into this message for improving their lung health?
Well, I think lung health is complicated, but it starts with the basics. It starts with very simple things, including tobacco smoke exposure, air quality, and then also taking care of getting the right diagnosis when you have lung symptoms. And so I think really that means finding somebody who can really listen to your story and then who can order the appropriate testing to get to the bottom of the question.
Great. So you're suggesting strong diagnostics before you actually start treating the problem. I think some of it starts from there.
Yeah, with most lung diseases, these are chronic. And so we need to think about a long-term game plan. And so I always think that just throwing medicines at the problem is not a very sophisticated way to approach it. Get the answer first before the waters are muddy, and then start the therapy.
Yeah. Now in India, yoga is huge. And especially after the pandemic, there has been a lot of stress on the importance of cardio and lung exercises. Is there any clinical evidence that yoga or lung strengthening exercises help with lung function?
There is a very little bit of evidence about breathing exercises and lung strengthening exercises. I think a bigger piece that those sorts of exercises do is that they lessen the burden on the lungs. So when the muscles are more efficient and the cardiovascular system is more efficient, the lungs have less work to do. And so for any given amount of lungs, you can go much further.
Great. So you've just heard from the expert everything about lung health, and we appreciate your time, and I hope you have a good rest of your visit in India.
Thank you very much.
Thank you.